It's so happy to see familiar faces, and also I'm very happy to see new faces.
Okay, so let's start immediately. So we will do a very short presentation. I mean, I will present Vicky, and perhaps she will present me. I'm not sure, but anyhow. So, first of all, we are a couple in work and in daily life. We are working together since 4 years. So, Victoria, she is Hungarian, and she's a well-known homeopath. She wrote a book about fish with the other name in her life, in her previous life. It was Bodrogi. So now it's just Victoria Nemeth. And she was the first one to write and to speak about fish. So I think that this was a very important work that she did. So she has a lot of experience in homeopathy, and we are working together, consultation together. We are teaching together, and of webinars and seminars too. So that's all what I have to do to tell about you.
Nothing.
That you are a beautiful woman.
Grab the words now to me, and I would like to introduce Roberto Petrucci. Who does not know him? He is a well-known Italian homeopath, teacher, medical doctor, and author of several books. He has a greater experience than mine. He's in this homeopathic field more than 30 years now. And he taught really all over the world, from Asia to America, and teacher of several universities or homeopathic schools. Also, he established several associations, and he's still director of Milan Homeopathic Center. As Roberto told, we are working, we are teaching together, and also we are book authors. But today we would like to present our new book that we wrote together. And the occasion that we gathered together today, this evening, afternoon, or morning, is that we can present you our child, newborn child, the ADHD, or how carefree childhood can be. So,
okay, so let's start. We will give you an idea of this book, and Victoria will give you an idea of this book, and in the second part, I will present a case that is not inserted in the book, so it's another case. So if you will get the book, you can read all the other cases.
Yeah, so our purpose is not book not available, so available about ADHD. Wonderful and brilliant homeopath wrote about this topic. As understood from, and also worldwide, it's coming more up to date, this disorder, ADHD, and we wanted to put our knowledge and our experience in the book that can be useful for really everyone, not just homeopath, medical doctors, but also to give an idea, to give a help to those parents, to those teachers, or everyone in the household who involved into this disorder. And also, it's important to highlight ADHD is not just a child problem. It's very common in adults. So the purpose of this book was to give it a help handbook to everyone. As you will see, we divided this book in 2 parts, but let's see the slides, and you will understand that what you can read and what you find it's in this very important book. So just to give an overall idea that how many person are suffering in ADHD. So if you see the number in Europe, the total number of children, 1,000% all children in Europe are suffering in ADHD, and the number in USA it's 9.4%. In Australia, it's 5. If you think all these percentage and numbers, these numbers are just the diagnosed children. So we do not know a lot of kids who are not diagnosed with ADHD. But if you put together all these numbers, so according to the data collected details in 2021, the total number of kids with ADHD worldwide is 172 million of children. And this data is coming from 18 years old, so which is approximately 7.2% of the whole population, so the whole population. You can understand this really, it's an incredible number, but not that, because I told it it's not just high, it's also disorder. So in adult from 18 to 4 years, that work was done, and based on the statistic on 2019, so 4 years ago, the 2.8% of whole population suffered or diagnosed with ADHD or ADD. That means that more or less 159 million of adults are suffering from this disorder. So let's put together in total, so for me it was incredible, 331 million of people worldwide suffering from ADHD or ADD. So you can understand that it's a very important task for us, and we want to try to give them help. So, but let's see that what is ADHD. Most of you are sure that knows that what all these syllables are meaning. So ADHD is an attention disorder. And I would like to highlight that it's not a sickness, or it's a neurodevelopmental disorder. Do not know the origin. A lot of speculations done in the past that what could happen in the pregnancy of the mother or from the parent, the parent. We do not know still where this disease is coming from. Just we know that from different diagnoses, different scans, and different studies, disorder influences the brain and its ability. And it's very important to underline and also to see that if you put into under the scan of the brain of a child with ADHD or the brain of an adult with ADHD, in 90% of the scans show the result that the brain are smaller than a healthy child or a healthy adult brain. So we can see that it's a developmental disorder. But what does it mean that the brain has the ability, that this neurodevelopmental disorder influences the brain's ability? So it means that receiving sensory information. Also, they can have a problem with coordination in movements or regulating mood and emotions, and also control of behavior. So you see that how many influences the brains are doing in different symptoms. But the exact cause, as I told you, related to the brain hyperactivity is still not fully understood. But what I told you, so the brain is smaller, it's a fact, but also that an association with dysfunction of certain neurotransmitters such as dopamine, neuroadrenaline, and serotonin, which play a role in the regulation of attention, mood, and behavior. So research has shown that in ADHD cases, the neurotransmitter dopamine and noradrenaline, which are responsible for the transmission of neural stimuli, and abnormally low. So to summarize, we see that dopamine, the serotonin level in ADHD child and in adult is very low. In addition, there may be also structural differences in certain brain areas that affect processes of attention and impulse, such as prefrontal cortex and ganglia. So you see that it's a neurological problem. And in adult, what the study work realized that they have lower level of glutamate, which may be responsible for neurotransmitter abnormalities. But we are in a book review an overall idea that most of you, I'm sure, know about ADHD. So what we are giving you with this book, which kind of knowledge, which kind of idea and tips. So I told you that we divided this book into two parts. So the first part we dedicated fully to ADHD in general symptoms, general understanding, general explanation in children and adults. Because really, for us, it's very important to see that ADHD is not just a child disorder. It's a very serious adult disorder as well. So in the first part, we explain the attention deficit and hyperactivity disorder basic symptom, which is inattention and impulsivity. We see forgetfulness, easily distracted symptoms, often loses things. So parents can tell you that my child is often loses the things or misplaces things. Easily or we see a fidgety. It's also always restless moving. We see difficult control the volume of the voice. So very high, very low. It's quite annoying that how usually the ADHD kids are speaking. Also, they can be very talkative one. Without stopping, they are just speaking. They can have difficulties in waiting, so they cannot wait. They turn to speak, to answer, to act. And what is more important in act, that they are acting quickly, immediate, without thinking. And that can be very dangerous. All these things are in the book with explanation that why they are doing and in which kind of other symptoms are in this theme of fidgety or inattention. In the first part, because most of you probably heard about the DSM-5 criteria, we also explain this if it's not so clear that what is the DSM-5 criteria that give a result of the type of ADHD. The DSM-5 is dividing in three groups: the ADHD kids, the predominantly inattentive or overly hyperactive plus impulsive kids, or combined type. Usually the neuropsychologists, neuropsychiatrists are working with this DSM-5 criteria, but if in your practice you will see that what is the result immediately, now you will understand, and also in the book is more detailed that what does it mean. But here on these slides you can see that also which are the criteria that a child has to be in, can be placed in this system, in this examination system, and also the explanation of the subtypes. So in the first part, we highlighted the idea of ADHD, that it's a general diagnosis. But with ADHD, it's often coming and associated disorders that as we, therapists and homeopaths, we do not consider, always have to consider these associated conditions, because these are that is giving us the help that which we have to choose in our team. Not everyone, of course, but always there is an associated disorder in ADHD, but not everyone has the same. So in ADHD, we can see ODD, so oppositional defiant disorder associated disorder, or conduct disorder, or we can see an anxiety, which can be also an associated condition, and also it can be very severe, because easily, really very easily, after a while, anxiety can turn into a very, very severe depression. We see sleep problems, child with ADHD. Of course, not everyone, but this is for us homeopaths, it's a symptom that if a child is suffering from sleep disorder, so it's an associated disorder, but we have to take into consideration it can come from the constitution itself. We can see learning difficulties in associated conditions. So all these conditions are explained, a more detailed explanation can be found in the book. But as I told you, so with this part 1 and part 2, we wanted to give a help, not just therapists and not just homeopath. So the first part, we are giving another help beside homeopathy, how to help ADHD. The first and the most common and most easy to use other therapy is the behavioral therapy, that we dedicated a chapter for it. And this behavioral therapy, we are showing that how we can control and manage our behavior, and also the behavior of the child. Also, we can see what is that thoughts, feeling, and we can see that how these three are acting to each other. And with this idea and also the tips of the behavioral therapy, you can handle much better, really much better yourself, and also the situation that the ADHD child can cause at home or at school. So with this behavioral therapy, parents can use this practice at home, teachers can use at school, and especially if you have this child in your household or in your practice, you can teach the child or the adult how to use this therapy at home and also at school. In the book, we are giving some tips how to help what to add in daily life, what to add, what to ask from the teacher if he is or she is able to cooperate with you with this problem. So behavioral therapy, I think that it's one of the most important therapy that you can advise and you can learn beside homeopathy to help in ADHD. The last chapter, 5, ADHD in adults. We are listing all the symptoms that can appear in adults, and also the other related condition can be different. Very seldom, if it's not a very severe pathology and an advanced pathology, in adult it's more not popular, but it's more common to see a personality disorder, a bipolar disorder, or an obsessive compulsive disorder. And in the book, you will read that which are the symptoms that related to ADHD or ADD. So, just stay on this idea of compulsion. This question came into my mind when we wrote this book, that why kids and adults can have a compulsion for sweets, alcohol, adrenaline, drugs, sex, or other things. And this is also very important to understand. The answer is lying in the brain. And it's lying in so-called, or how I can increase the dopamine or serotonin level by adrenaline or glucose. So this is how a brain of ADHD is working. We call this syndrome reward deficiency syndrome. So every behavioral reward, what can be in ADHD? In child, we see a lot of child craving for sweets, eating always chocolates, because it's increasing the dopamine. In children, a little bit later ages in the but in that we see a compulsion for sex or pornography, or a different type, a kind of music, not a pop music. So it's a more adrenaline-like music. We see pattern in high-risk activities. We see extreme activity desires, or which is very dangerous in teenagers, that they are searching for fast-acting drugs. Also, they are searching alcohols, and later they will complete situation. But why? It's lying in the fact of the low dopamine level and the self-reward system. Because all these ingredients, all these stimuli triggers the dopamine spikes, and the brain feels a temporary, and it's very important to understand, a temporary satisfaction as an intense reward. The one bottle of wine, it will be not enough. Next time we will drink another one, next time another, and it will become a compulsion. And this is like in child eating chocolate, it's a compulsion. But if you are taking away, the child will find another reward system, another reward ingredient that can stimulate the brain. So we can say that ADHD kids and adults are dopamine seekers, but this dopamine seeking can turn into torturous daily self-regulation challenge. So this is what I explained later before. In ADHD, the brain is sending out distress messages randomly, really randomly, out of blue, demanding more glucose. And this demand causes disturbances in behavior or sudden cravings. So when there is a sudden reaction in a child, a sudden anger, a sudden outburst, a sudden kick, whatever, this is because the brain is immediate send out distress messages. I need glucose, I need something adrenaline, because I'm not feeling satisfied myself. So this is how the brain of the ADHD child or adult is working. And for them, it's really very difficult to manage it. But we are here to listen about this book, and we are an advanced homeopath, most of us. So from this book, but also it's just another tip, we are able to handle them, and we have the knowledge in our hands to handle them, and we have to handle them. We have to help them. So in the second part of the book, we dedicated this part completely to homeopathy. We are homeopaths, so we cannot think differently. And in this session, we are speaking about different types of children. We are mentioning many remedies. We are presenting cases, and also we are giving ideas which kind of rubrics you can take. But let's take it open this book and see that what is really in this second part. So at the first, we are explaining the different type of ADHD in the understanding, and we are adding more and more symptoms through the additional disorders. How the children is acting with the basic symptoms plus the additional symptoms and so on. Every types, in every types, we were placing a triangle that from the basic to the top, how we can understand the constitution of the child, how we can understand the core of the problem of the child. And this is also a help in this book to how to reach it, which kind of rubrics can help you, or which kind of questions can help you to reach the peak of trial. So in the book, we listed 9 different from the very end used to the more. You can see that from the deficient disorder to the latest state of depression, you can find all the types. Also, when we are seeing an ADHD case during the years, because we have more than 10 years experience in ADHD, and we have really hundreds of cases, and little by little we understood that with the homeopathic approach, how we can give an easy way and help to other homeopaths to understand easily the character and easily to divide the kids into 2 parts. And we name these 2 parts. One part is the extrovert child and the other is the introvert child. And when you reach this point, what does it mean extrovert? What does it mean introvert? And in this book you will read the rubrics of the extrovert and introvert child. Immediately you have a smaller selection of remedies that can help you and especially help them to manage the problem of ADHD. So, which rubrics you can take when, for example, face to a child with extrovert or introvert? Just give an example, which kind of type you can speak about. So we can speak about, for example, a bossy type. And when we are hearing this attitude that the child is always telling to everyone what to do, she's or he's the boss, no can tell no to him, immediately we can understand, okay, it's a bossy type, so we know that it's an extrovert type, because an introvert child is shy, will never give demands and comment to the other people. And from the introvert side, we will see a depression, a huge depression. So when you understand a lot of anxiety, a lot of depression, a lot of lack of confidence is happening in the child case, immediately you can allocate this pattern to the introvert group. And also we can see children that have this desire for self-amusement or to amuse others. This is also a pattern that is coming from an extrovert group, or a violent type, or a frightful type. You will see all these patterns and these subgroups in the group. That is very important to understand the constitution of the remedy, or constitution of the children to reach the right remedy and to give to your patient. Also, in this second part, we grabbed one of the main important associated disorders in ADHD with the knowledge of homeopathy. So, for example, just to grab one additional associated disorder, which is learning difficulties. So we are giving explanation of the different types of dyslexia, dysgraphia, and dyscalculia. We are giving ideas and tips which rubrics can help you to place into your repertory to find the right remedy. And then I think that this is the most important part of the book, and important knowledge that we can give to you through this is that we listed 21 commonly used remedies in ADHD in the chapter 8. And how we are introducing and how we are showing these remedies is very important, because we gave a kind of schema in this explanation. For us, it's very important to understand if there is a characteristic in a remedy, the appearance, because the appearance of a child can give us an idea, an immediate idea. Also, we have to understand the development of the remedy, because not every remedy has, for example, an early teething, an early dentition. For example, in calcium, we can see a late development, a late dentition. And if the dentition is early, you will never prescribe calcium, because you know that the calcium development is slow. So this is why it's very important to understand the different developments in different remedies. Also, we are giving ideas in the learning problems in different remedies, because not every remedy has the same learning problem. And this is also an idea. If you have an idea that, for example, okay, why we are not giving phosphorus to the child? Because it's fit more or less, let's say more or less, to this child. It's covering most of the symptoms that they are telling to us. But if you check that, for example, the development, the learning, and all these things are not really fitting, you can ask, okay, but what if it's not a phosphorus case? So with this idea, with this list of remedies, we are giving you the most common themes, the most common pathologies, the most common explanation of the remedies related to the ADHD and related to the kids that you cannot miss when you are prescribing this remedy. And also in ADHD, it's a very common symptom, this sensory organ sensibility, or hyperactivity for noises or smells, or smell odors or noises or lights. And this is not in every remedy the same. Also, we are explaining the characteristics of the different remedies to understand that which kind of behaviors you have to see in the different remedies. Part, we are giving the sensibility of the different organs, the sensibility of the different diseases and sickness the remedy can suffer from. In chapter 9, we are presenting our cases. We wrote 14 cases of ours with the latest how explain the remedies. So you will see the age, the gender of the child, and of course the pathology is ADHD, but we were according to every, you will see the details of the mother's pregnancy, the details of the birth, the details of the development, the characteristics, sensory sensitivity, also the child's complex, so how the child is acting school or in the nursery or it's in a preschool. And through this layout, you will understand our idea method to arrive institution. And also, it's also you can put together the pattern, the remedy, and the case together. After every case, we wanted to show you that these cases are really a very long years cases. It's a very taking care. So we took care of this patient, and still we are taking care of our patients very seriously. So that's why for us it was very important to list in percentage the development, the evolution, the amelioration of our cases. So after every cases, you will see a resource score. What happened in the physical level? What happened in the mental level? Mentioning all the symptoms. What happened in ADHD? How many percentage of amelioration we could reach with the constitutional remedy? And in totality, in general, from the beginning till the end, how is the amelioration in total in the child? And at the end of this list, the score list, we are giving the number of years of follow-up. So you will see that these are really very follow-up cases and very serious cases. In the last two chapters, so chapter 10, are giving us about question, which kind of question you can integrate into your anamnesis form, or if you stuck during the case taking, it can happen. You can open your book and you can search which other questions can help you to open the case, to continue the case taking. In chapter 11, we are giving ideas of different rubrics, and these rubrics we divided in themes. So for example, themes of anger, themes of learning disabilities, or themes of depression, or themes of general attitude. So we are in this book review with the collaboration of EMRIS, and on EMRIS website you can find all the books that we wrote from the Waterword Fish in Homeopathy, and also the group and themes and children that the author of you, Petrucci. Now cheer up ourselves a little bit with a wonderful case of Roberto that is not in the book. So it's a gift to you. So the word is yours.
Okay. So you convinced me to buy this book. So first of all, I want to underline what's told is always to treat the patient in the totality. So we are not searching for a remedy for ADHD, but we strongly believe that in most of the cases we have to prescribe a constitutional remedy. So in this case, I would like also to underline how to avoid to prescribe incorrect remedies. So the case of a child, 4 years old, in December 2000. So long follow-up, but the result is really very, very interesting, because in the book we are giving also cases with more than 10 years follow-up. So in this case is a case with some problems with behavior and sleep disorders. So the child went to other homeopaths. So these are the prescriptions that he got in the past. So another homeopath prescribed calcium carb, 18 lm for 2 months, 2 times a week, and then Nux vomica for 1 month, 2 times, without any result. In the history of the mother, she had problems during pregnancy with diabetes during pregnancy. Related to the child, the development, the first tooth was when the child was 5 months and no any disturbance. 11 months, he started to walk without support, and he got all the vaccination as national protocol without any disturbance. He had 2 episodes of tonsillitis in the past, and from the let's say mental point of view, he's always running and he likes games of movement. He's always on the move, but he's not violent. He's very touchy and is very jealous. He likes water a lot, no particular fears, he's not afraid of the slide, willingly jumps. He likes to be in the center of attention, and if others don't take care of him, he starts throwing and having tantrums. He's very, very capricious child with almost hysterical reactions. When his mother scolds him, he has major reactions, sometimes banging his head against the wall, taking off his shoes in the middle of the street, or pulling down his pants. Well, and he follows the rules, doesn't hit even. In the office, he behaves well, but he touched everything in my office. And the child is giving restlessness and capriciousness. Then there's the problems related to sleep. So until he was 3 years old, he had nocturnal pavor. And when he came for the consultation, he was waking up 2 times a night and takes at least 20 minutes to fall back asleep. He's very it's always related to sleep. As a baby, he had to be vigorously rocked for a long time. He's grinding teeth at least 2-3 times a week for 2-3 months, and does not want to go to bed very late. Is hypersensitive to pain and very warm-blooded. what I did without telling you the remedy, just what I prescribed. I started giving him, usually we are using Korsakoff potencies, and I started with 1 m, and I gave him 3 drops 1 time a day. So the first follow-up was by mail after 3 weeks. And the mother wrote, "He falls asleep much easier. Sleep quality is much better." And she wrote mine too. He only grinded his teeth a couple of times. His reactions are the same, but they come back more quickly. He's always in this perpetual motion, and then she wrote, "In these 3 weeks, the child has been constantly healthy with a small interlude of a dry cough that had healed quickly on its own." So I just add 2 drops, and I gave 5 drops 1 time a day, and I get another mail after 2 weeks. So it's 5 weeks from the beginning of the therapy. And the mother wrote, "The child is doing much better, and we are only at the end of the 2nd week, I mean the 2nd week with 5 drops. His reactions have calmed down, and we are on the right track." For a couple of days, now he has had a stuffy, dry nose, and since yesterday, I have felt that he has bad breath linked to inflamed tonsils and a few coughing fits. And she's asking, what can I do to prevent it from worsening into tonsillitis? So for this reason, I gave the remedy more frequently, staying always on 5 drops, but for 2 days, 4 times a day, then 2 days, 3 times a day, and then going back to 1 time a day. So after other 2 weeks, she wrote, "Your suggestions on the acute worked well and very fast. The child is better. The reactions are in line with those of a child of his age. They are not frequent or paroxysmal. Even perpetual motion is no more. Sleep has improved. Only sporadically we have restless nights. And the grinding of teeth was unfortunately more frequent and is often sweaty. So many things were better, just this grinding of the teeth became more frequently." So I stayed on the same potency, add 2 drops, so I went to 7 drops 2 times a day for 3 days, and then going on 1 time a day. Then she called me for an acute. It was the 26th of February. On Sunday evening, I was on duty, so she spoke with me, and she said that he went skiing in the past few days, caught a cold, and got very tired, and now he has 38 fever and cough. So I gave 7 drops every hour, and in a couple of days, no more problems. And after 2 days, they came for the consultation, and the mother told is less restless than before, is much more reasonable, no more important reactions, and when he gets angry, he no longer throws himself on the ground and beats himself up. And this is just a little bit more than 2 months from the first consultation. Less easily offended, jealousy is much better, and the desire for chocolate decreased, and he had less restlessness from chocolate. The mother is happy because he's kid with pleasure, whereas in the past he would have been less resilient and would have tired sooner. Perspiration now only happens with fever or in special situations. And when I get a mail, the 20th of June, and the mother wrote, another month passed and the child is getting better and better. No waking up and no teeth grinding during the night. His reactions are fully aligned to what is happening with cheerfulness and smiles. He's a little bit more agitated in stressful situation when he's tired, angry, and when a lot of people are around him. A big change will happen in our life in September. We are moving to Arabia when we will finally be able to reunite the family, since both my husband and I have found jobs in the same settings. Both of them are vets. The last prescription, last time that I spoke with her, it was end of August, and he's taking 10 ml 8 drops once a day. So I want to show which rubrics I used for this case. So, of course, some rubrics are more important, other rubrics are less important. So for us, hierarchy is always, hierarchy and totality are the two keywords that we are using always in our cases. So the restlessness is easily offended. Then there is the jealousy in children. And I took also the rubric ailments from being neglected. Then capriciousness, temper tantrums. Then I took some rubrics and I combined with striking himself, heads, and head against the walls, and you are seeing these three rubrics. Then what he did in my office is touching everything, and the angriness from chocolate. Then a very big rubric, sleeplessness, and then what happened in the past related to the pavor that he had until he was 3 years old. So this fear and anxiety at night, and this amelioration and desire for being rocked, and then the grinding of the teeth during sleep. And then the mother said that he is very sensitive to pain. So, what not to prescribe? Because many remedies can come into our mind in this case. So, I will tell you what I thought during the consultation and why I decided not to prescribe these remedies. So, in these cases, we can think, for example, to Hayashamos. So, but jealousy and violence in him are not so extreme. Arsenicum album is coming from the repertoire years. In belladonna children, I'm expecting striking other children, biting other children, and it's not this case. Also, carcinosinum is coming from the repertorization, but we know that carcinosinum children are sweet children doing everything not to be reproached. Related to lycopodium, there's no gastrointestinal complaints in this child, and related to respiratory. Stramonium, I'm expecting a strong fear of dark, and it's not this case. With dentition, problem with dentition, and calcarea, there's no delays in development. So this is the repertorization, as you are seeing: Iosciamos, Arsenicum, Belladonna, Carcinosinum, Lycopodium, Tuberculinum, and so on. But the remedy that I prescribed was Saccharum officinale. So it's a remedy from the group of Graminaceae, so Poales. And if you are understanding the themes of this group, you understand how strong is the tendency to invade the life of other persons happening in nature. The only remedy, according with our understanding, that has not this tendency, I mean, from the homeopathic point of view, is Bambusa, because Bambusa is an atypical Poales. All these rubrics are rubrics that we can find in Saccharum. So you see anger, disobedience, hysteria, impatience with anger, impertinence, insolence, irritability, quarrelsome, rage, and violent. Now, if your way of working is trying to understand and creating these 8 essentials for every remedy and for every group. For us, the essentials are not notes. So keynotes is something else. If to give you an example, if we are reading keynotes of calcium carb, for example, we are reading that calcium carb has the desire for soft-boiled eggs. I will never prescribe calcium carb because a patient is eating boiled eggs. Perhaps this be prescribing on teams and on these essentials. So if we are thinking of Saccharum officinale, and I hope that this will be useful for you to recognize this remedy that is not so easy to recognize. So we are seeing this remedy in the first phase, like a remedy with lack of self-esteem, fear of failure, forsaken feeling, sensation of being neglected, and jealousy. This is what we are seeing in this remedy in the first phase. In the second phase, there is this very typical tendency of Poales, that is to invade other space with searching for power. We see a lot of behavior problems in children: insolence, disobedience, capriciousness, irritability, hyperactivity, and ADHD. They have always the fingers in the womb of the mother, suture, objects, nails, they are biting also their 2 nails, and food. And in fact, this is a remedy that is very good for eating disorders and obesity with restlessness, because we are thinking usually to remedies like tuberculinum or arsenicum iodatum that are remedies that are very restless, but they are thin. Saccharum officinale usually is good for obese patients or quite fat patients that are restless. So there is a strong desire and aggravation from sugar, chocolate, and sweets. Then there is this love for strong movement, and the newborn loves to be carried very vigorously, whether in the arms or in the baby stroller. So when you are seeing this is a remedy that I'm I'm calling the shaker child. I mean, the mothers or the parents have always to shake very strongly these children. Then there is the relationship with pain, and we can have or a strong sensitiveness, or this remedy is also listed in the rubric, in the generalities, painlessness of complaints usually painful. And they are warm-blooded patients with tendency to. So this was the case. Just one moment, because I have to show you a message. Okay, we can get to thank Jenny, that is the editor of our book.
Hi, Jenny.
Thank you very much. Thank you.
We would like to say a big thank to Emrys, to our publishing company, to Olivier, wherever you are. We hope the kids are all right.
Yeah.
And also Jenny, that she had to go. She's a fantastic woman, and I keep her in my heart, and you all in our heart. Keep in touch, and whenever you need help, whenever you want to share something with us about ADHD or about your work or about homeopathy, feel free to write us, feel free to contact us.
And don't forget ADHD in adults, because it's really very, very, very frequent.
Yeah. So have a nice evening, have a good night, good morning, good afternoon, wherever you are, all over the world. Big hug.
Thank you very much.
Bye.
Bye. Ciao.
Bye-bye.